So while the presentation comes up, I'll just give my quick introduction so that we can skip a couple of slides on my introduction. I spent over a decade on artificial intelligence. I've been on data science. I've taken up courses for data science from Johns Hopkins. I was the first hire for Facebook back in 2010 when they were setting up their India team. Facebook was not yet sure about whether they want to set up their engineering center in India or not. But I played a pivotal role building some of the early systems, got introduced to some of the brightest minds. My AI journey actually got started at Facebook. And then I set up the first data science team for one of the largest gaming company called Electronic Arts. If you're into gaming, you would have played games from EA Sports. EA Sports is just one of the studios of Electronic Arts. So I've been into situations of data coma is what I would call it, like food coma, where you see a lot of data coming in, good quality data coming in these companies, and then you know how to apply statistical models, build systems. And then there are very smart folks to work along with who are doing research as well. Leveraging that opportunity, we got to build these churn prediction models, spend propensity models, which is like predicting who will not use these systems in the next 7 days, who is going to get dormant. And then eventually I realized this is all on entertainment side. Where is the real impact? I joined a startup called Cognitive Scale back in Austin. So at Cognitive Scale, I had a great opportunity to work with MD Anderson, 2015, 16, 17, pretty early adopters of AI, Ascension, Anthem. I mean, like you name some of the best insurance companies and healthcare companies, and I had a great opportunity to learn exactly on ground the challenges, even when US was in this phase of so-called data science adoption and AI adoption, how things really look like, how hospitals think about it, how researchers think about it, and I realized that's really critical for us to bring back that knowledge to India. And then after my stint at Cognitive Scale, I moved back to India. I set up a startup in deep tech. Real challenges, we did not have data of that sort. The kind of awareness that we see in 2025, I was trying to sell that in 2017. I realized I need to work very closely with governments, which was something very difficult, tricky for me at that point of time, because I came from very crisp, clear, organized way of working in corporates, and dealing with e-governance was a very different kind of challenge. And what really evolved in that duration was we built a great product, we got a good valuation, I got a very nice exit for one of my startups, and I realized let other people really drive this. I became a serial entrepreneur in that journey. I wrote a couple of books now. The first one, AI for Everyone, is a bestseller right now. There are a lot of scenarios on healthcare that we have covered in that, so please try to pick your copy from any of the airports. Moving on to like what really happened in this journey was I joined think tanks of India, which are consulting and writing policies. I write a lot of policies. I've written policies for AI in healthcare, AI in SERP, which is for helping poorest of poor take benefits of these kind of health systems, while large hospitals like Yashoda do CSR and they support how really that reaches to poorest of poor, how are we actually supporting them. So policies really play a pivotal role, and I joined Honorable CM of Andhra Pradesh, Sri Chandrababu Naidu's think tank. I'm one of the chief strategists there, working on bringing digital platforms to different state government departments, not just AP. Through that, we work with Niti Aayog, NASSCOM, and many other similar bodies. And in this journey, what I'm going to talk about next is policy part of it. How do we really tame this artificial intelligence bit? Because while there is so much of know-how, great knowledge, there's confusion of like being in the best place, working with the best brains, opportunity of being in the US, UK, and then looking at what we really want to do as like NRIs, or maybe as an Indian, as a citizen, there's an opportunity of bridging that gap. So it will not always happen just sitting here, but again, like bringing that knowledge back, figuring out what's the best practice everywhere else. And we thought, like, let's start putting some of the policies, and some work is happening. And there is work to be divided between private organization, a lot of startups which are trying to claim that they build great AI products, working with large organizations like Google, Microsoft, AWS. How do we take that support because they're ahead of the curve, because I've been there in some of these kinds of organizations and I've seen how they really think about things, how they ensure there is governance model into something that they're building, and how our startups would actually miss on some of those pieces. As a Stanford Seed mentor, what I've really seen with a lot of good startups that come through even that channel is when you ask, they're working on a healthcare use case, and you ask, do you have a doctor on your board or somebody from that medical fraternity? At times that would be missing, which means that they're only picking up data from some partners, they're working with some partners who would enable them, but in reality, they don't have anyone validating the governance model. So what really matters and why governance really matters is that adoption is happening very fast in terms of AI. Each one of us, we have our own challenges. I mean, as doctors, you would be thinking about something that how AI is going to help you or is going to impact you. Are you ready about it or not? So I feel AI is like English. Like you would be great as a medical practitioner, but knowing an additional language really helps you globally connect. I mean, like you might have something else as your mother tongue, but you pick that up in this course of journey, and eventually AI will become part of our curriculums, which is happening right now. And one of the beautiful statements I heard at MD Anderson from one of the very senior oncologists was, Sridhar, I would love to see a digital twin being created from this AI, that when I'm gone, I'm still eternal, which means my knowledge is available even after I'm gone. And if there was questions asked to me by my juniors, I would have addressed it in a certain way. If AI can really replicate that knowledge and give it to them in future, I think that's what we really need in terms of digital twin. So looking at all of these dimensions, we realized definitely there needs to be aspirations like these to be converted. But on the other side, how do we really make sure there is a governance model? Everybody has talked about the bias bit of it, the possibilities of misuse that we have heard in parts and pieces. So how do we really bring innovation and there is accountability? And is there a solution for that? So I'm just going to quickly talk about the solution part of it.